in this environment, what is really happening that I think is a game changer moving forward for sure. So one is this flexible settings. So this idea now that you can do more services at home than CMS would ever let you do. This idea that you can do audio and video telehealth, which before you couldn't do that. That's a big game changer. And I will tell you, you'll hear me, and as you heard earlier, this telehealth, telemedicine space is going to explode for a couple of reasons from the government perspective. Number one, they've done a lot on telemedicine, down to specific codes for people to code. The Office of Civil Rights has waived a lot of the HIPAA rules. FCC has changed a lot of rules. A lot of Stark rules have been waived. So you'll see they've done a lot of work trying to figure out how to make this work in an environment that's pretty regulatory and not really telemedicine, telehealth friendly. And they've done a lot to make that happen. They like I say, this flexibility, what they're calling hospital without walls, huge. I mean, it's really going to be a game changer. They've also changed the scope of practices. So of course you still have to follow state laws, but they're much more willing to let mid-level practitioners do a lot of the work that before only physicians could do. And then the other thing to ensure capacity that they're doing is expediting the enrollment for providers. So for the first time in the history of CMS, providers can get enrolled in 7 days. I've talked to the MACs, the Medicare Administrative Contractors who do the enrollment process, and they're up to date, and it's amazing the job they're doing enrolling providers in 7 days. It's pretty shocking. So capacity has definitely been a significant issue that they've increased. Now, how do they do that? So they're doing it through waivers of statutory authority and waivers of regulatory authority. And you'll see every day there's another waiver coming out saying that they're not going to impose some of the rules. And then the last thing that they really do, the how, is clearing a lot of the bureaucracy. So a lot of it is just paperwork. For example, it's paperwork and it's some of the bureaucratic requirements. So for example, they're stopping a lot of the audits until probably next year, which, just to make sure that we can get through the crisis. The quality performance ratings for plans and even for hospitals, they're starting to delay some of the actions they may take if you have poor performance. They're even thinking about what do we do with 2020? I mean, 2020 is a big anomaly, so it's a giant issue for the government. What do I do with everything that's happening in 2020 compared to the way the world was in 2019 and how we pay and how we reward providers? And then the last thing I'll say is survey and certification. People don't think a lot about CMS and doing the survey and certification process, but it is a giant job. And they're starting to figure out, how do we do a better job of surveying? Should we change what we survey based on what we've learned in this environment? So that's my quick view of the government space and what they're doing to try to address the pandemic.
So Charlene, some of the things you described that relate to making things more efficient and less bureaucratic and getting things done faster and more effectively, some of them sounded like they were thought about as somewhat transient to deal with the current crisis. I'm wondering, do you think when this is all over, whatever this is all over means, whether some of the efficiencies will have been found to be good to keep in the sense that maybe some of the things we've done or have felt we had to do in the past, we can learn to live without or to do differently, so that maybe we come out of all this with some permanent efficiencies in what is a gigantic and complicated and sometimes bureaucratic enterprise.
Sure. So I advise everybody who's involved in this crisis to keep data, to record the changes that you've made and how you've made them. I think it's going to be really important for CMS to be able to go to providers in this environment and say, what did you do? And show me the results of how it worked. So I think if we have good data that shows that it's working, absolutely. I can guarantee you, well, I shouldn't say guarantee, I'm pretty positive that telemedicine is going to change significantly because we are seeing the value in that already. But some of the other changes, for example, even the quality performance measures, right? That's a good one, right? So for managed care plans, we have these star ratings and quality performance. Did they really matter? Like if we suspend all of those for now, what did that healthcare look like at the end and what changed and what was impacted? So I think CMS will definitely look at it. What I ask everyone to do is they're going to need help finding the data. So that's super important. The other thing that I'll say is if in fact they don't change these rules permanently, this is right for the Innovation Center to continue doing what we're doing on a demonstration basis and in smaller environments.